Absolutely. Well, copay assistance coupons is a way that drug companies help patients that need those medicines actually afford them and access them as prescribed by their physician. So literally, it's payment support that helps a person purchase their medicines when they arrive at the pharmacy counter. Oftentimes there's a card, maybe they sign up for it at the pharmacy or over the internet. But it's a way for companies to help people afford the drugs that they make that we know are so important to people in maintaining their health, particularly for people with chronic conditions. You know, in West Virginia, you've got something like 1.2 million people that have chronic conditions, so they're automatically more likely to be taking medicines and managing their health. You know, and you think about in the Clarksburg area, at least 500,000 across West Virginia, including in Clarksburg, have 2 or more chronic diseases. That really puts these patients at risk of incurring high costs for the medicines that they need. This coupon assistance program that allows drug companies to help with those copays that are required under most health plans to be met is critical. Well, there's a lot of people in West Virginia, a significant number that are affected by chronic diseases. You know, across the country, 1 in 2 Americans have a chronic condition. And so that we know in states that are maybe a little bit more rural, where there may be people who are a little older, there's a higher incidence of chronic diseases. You know, in West Virginia, generally there's something like over 500,000, 527,000 people we know have 2 or more chronic diseases. So for those individuals who are taking multiple medications to manage their health, they're paying 3 to 5 times what someone without a chronic condition might need to pay to afford their medicines. And in our view, that's why we want this program that's currently in place that offers copay assistance coupons to stay in place, because these individuals, these patients with chronic conditions, absolutely need that help to afford and then stay consistent with the health care regimen that their physician has prescribed. The Department of Health and Human Services actually considered the idea of copayment assistance coupons last year and thought about putting this policy forward that would allow insurance companies to no longer count, or at least be required to count, the value of these coupons toward a patient meeting their deductible or their cost-sharing requirements. And that idea came back. And we're not exactly sure why, but you know, sometimes these proposals just never really go away. It's clear that there could be parts of the healthcare system that would benefit by keeping a patient, you know, short of reaching their full out-of-pocket limit. Sometimes when someone achieves that goal, then there's more services that are available to them without charge under their health plans. But we know that for people with chronic conditions, we want them to have the medicines that they need when they need them. We want them to be able to be affording those medicines in a way that they don't skip a dose or cut a pill in half. That's critical to helping people maintain their health and well-being, and HHS is poised to go down the wrong path. And so I'm hopeful that for people that are viewing, you know, your broadcast, that are in Clarksburg, that they've got some information now to take forward to HHS to say this is not a proposal that we can support. Well, you know, all of us want to lower health care costs. Across West Virginia, you know, there's billions of dollars being spent on health care, particularly for people with chronic conditions. And so you would think that we would do everything we could to support individuals in buying their medicines and affording the care that they need. That's what this copay assistance program does. Who would benefit? You know, as I say, it's possible that the insurance companies and the pharmacy benefit managers would see a benefit in having people stay kind of under their caps for out-of-pocket spending, those limits that are imposed. But it doesn't make sense in the long run. People, when they're struggling to afford the medicines they need, oftentimes stop taking them, or they don't take them as prescribed, and that's going to undermine their health and ultimately harm them and cost us all more money as those individuals end up in the hospital, as their conditions deteriorate, as they feel forced to not have the care that they need simply because we've taken away a support that's there currently. You know, it did get set aside last year. Patients, physicians, other stakeholders weighed in with HHS to say this is not the direction that we feel is productive for patients. It won't help them get access to the medicines that they need, and yet here this idea is back again. So I've been around Washington for a long time. I understand that once a proposal's been put forward, they oftentimes do resurface, and all we can do as advocates for patients is step up and tell HHS during this comment period, it's open right now, they're interested in our views, we need to tell them once again that this was a bad idea last year and it's a bad idea again this year. And it's hard to really see how any aspect of the healthcare ecosystem benefits, because ultimately patients that get the care that they need, that have the supports that allow them to get that care through copay assistance and other support, are going to be healthier, they're going to be happier and more productive, and it will save us money as a system in the long run. You know, I would love to issue, and that's what I'll do right now, a call to action to residents of Clarksburg and the surrounding areas. You know, we need you to weigh in, particularly if you've got a chronic disease or more than one chronic disease and you're taking multiple medications. We need for you to join us in helping HHS understand that this is not a good direction. This is a step backward. And I would urge you to come to our website, aarda.org. It's AARDA.org. And we've got information about this HHS proposal and information that will allow you to contact HHS and share your views. And then I would encourage you to actually speak to your representatives representing the Clarksburg area at the State House and in Congress to make sure that they also understand and are watching HHS in this process. The patient voice is a strong voice. It worked for us last time. I would encourage Clarksburg to really step up and lend its voice on this very important issue.